I watch a lot of TV late at night, and one of my favorite shows is Forensic Files. And I marvel at Forensic Files because oftentimes they have a story about something, a crime or a murder or something that had happened 14 years ago before they had the advancement in technology for DNA. And, it's just kind of interesting in today's society how things are different because of science and technology. And it's my understanding when I was coming up, they said that sickle cell anemia was an incurable disease. But it's my understanding now that because, and you can talk more about it, that because of the advancement, if you please, in science and technology and medicine, that it's now in some instances curable. This is a call to action. A call to action. I'm your host, Alex Habersham, and I'm more than a little pleased to be able to be interviewing Dr. Vishwas Sakaka, who is very, very experienced in sickle cell anemia, the treatment and the causes and the history and things of that nature. And of course, it's something that's close to my heart because I happen to have had several friends, one who have it, one who died from sickle cell. Plus, I believe very strongly in the power of information because oftentimes there's some knowledge and some information out there that will help to benefit society, not only medicinally, but in other areas. So thank you for coming, sir.
Thank you very much for having me here.
Yes, sir.
Thank you very much, Mr. Habersham. I'm privileged to be here on behalf of my sickle cell disease patients and on behalf of Navison Health.
Yes.
You made very important, very good points about sickle cell disease being a very difficult disease. On one hand, as you said, very sad to know one of your friends passed away due to the sickle cell disease. I want everybody to be aware that it is a very difficult disease, not a very minor, simple disease. On the other hand, with our knowledge now and technology, medical technology, we have many good ways of controlling the disease and also in some instances curing the disease.
Wow.
Which is by means of something called as a bone marrow transplant. Bone marrow transplant is not a very simple procedure and it does not work in always every of the cases, which is why it is not so well published or so well known to everybody that bone marrow transplant is a cure, but it is undoubtedly a cure for sickle cell disease.
Talk a little bit about, the causes and the signs of sickle cell.
Sure. So sickle cell disease is a genetic disease. It is in our genes.
Wow.
It is we are born with the disease. The disease is transmitted or we get it from our parents. Each one, the mother and the father, have to carry the gene. In which case we call them as carriers. We call them carriers because they do not have the disease. They look completely normal for almost every blood test and symptoms that we know. They have no problem at all. However, the child, if each of them are carriers, there is a 1 in 4 chance. It's just a chance, like a flip of a coin. You cannot predict for sure, but 1 in 4 of the kids would have sickle cell disease. It could be a boy or a girl, doesn't matter, but they would have sickle cell disease right from birth all until they die.
Wow.
So what symptoms, what they have is a few number of these kids, believe it or not, touch wood, would never get sick in their life. So which is why some people do not believe that the child may not have sickle cell disease, because there have been cases where the kids have been fine, at least to our general eyes. But most of the kids start having problems right from few months of age. They have some pain crisis beginning in their hands and feet. and maybe other areas of their body, basically muscles and bones.
You said they have pain?
Pain, yeah, and the pain can be
Wow.
sometimes very severe,
Wow.
very debilitating, so much so that they might be needing hospitalization to control the pain. And that's one of the most painful part of the disease, if I have to say. But that's not really the most dangerous part of the disease. The more dangerous part of the disease is what we call acute chest or lung crises, when the blood supply to the lung is affected and they can get difficulty breathing and could die due to pneumonias either at that time or after multiple pneumonias later in their life.
Wow. And we'll engage in a very, very interesting conversation at this point about sickle cell anemia, the disease. And we're talking with Dr. Vishwa Shakalkar, a medical doctor who is an expert in sickle cell along with childhood cancer. And we're talking about, some of the symptoms and some of the signs. And so let's talk some about the treatment. Now, let me ask you a question before you talk about that. Do the young people die? How often is death, or what's the regularity of death for people who have sickle cell?
Wow, that's a very important question. So we do not have the most recent data about death, but until a few years ago, about a average sickle cell person would die, sickle cell illness, SS disease, the worst type, would die in the 40s, about 45 or 50 years of age. The milder disease, they can live up to the 60s. So it is a very difficult disease, and even you will say, well, they live at least in the 40s, but their life is full of a lot of painful episodes. They can get very sick and not productive, not enjoying joyful life. That is what hurts me more than just the length of life. So also some of them could die very early from infections, as young as 2, 3, 4 years of age.
Wow.
So infections can kill them, and strokes can also kill them or debilitate them. They can get, paraplegia, hemiplegia.
Does it take a while for people to know that the child has sickle cell, or does it reflect it through blood tests, or what?
Very good question again, Alex. So in United States, most states have mandatory blood tests at birth. So almost all of our kids born in the United States parents know within weeks of birth whether they have sickle cell disease or not. Rarely some kids come from a different country and then they may be diagnosed later, usually between 5 to 10 years of age.
Yeah. What are the numbers as it relates? How many, say in Georgia or in Central Georgia, do we have young people or people in Central Georgia with it?
Yes, it's a very, very common disease, especially in the African American population, because
now, let me ask you this. Is it limited to African Americans?
It's a very good question again. While it is very common in African Americans, it is not absolutely limited to African Americans. Caucasians, any race for that matter, can have sickle cell disease, but it is far, far more commoner in African Americans, having originated from the tropics of Africa, Asia.
I understand. So how many people, say in Central Georgia, roughly, would have sickle cell?
So that would go in about thousands, actually. In the United States, there are about 90,000 people with the sickle cell disease itself. The number of carriers is far, far more. About 1 in 12 African Americans in the United States are a carrier of the gene. So, even in our room, we could have somebody who is a carrier of sickle cell disease and not know about it.
Good observation. So there's no way to detect that one is a carrier? Is there a way to detect? For example, if two people wanted to get married, is there a way for them to have a test to determine whether or not, that he's a carrier? and she's a carrier?
Absolutely. There is a somewhat simple test to do it. It is called as hemoglobin electrophoresis. By doing that test, you can find out whether the person is a carrier or not. And it is very helpful to do the test, at least when the mother gets pregnant. When the woman gets pregnant, she should probably do the test, especially if she's African American, to know what is the chance your child is having sickle cell disease. Now, it will be even better if somebody is as smart as you are and do the test before marriage itself. That way, you are not burdened with the decision once you already have a baby.
Now,
So,
would the child necessarily be afflicted with sickle cell if the two partners, the mother and the dad, are carriers? Would they automatically have sickle cell?
no, 1 in 4 of the kids
you told me that.
Could have the disease.
Yeah, so there's
and it's a random chance.
Okay. There's a possibility that, and what we want to do is talk about childhood cancer some, because I'm sure that the audience is interested in information about that. I'm your host, Alex Habersham of A Call to Action. I'm pleased to be able to bring you this interview today, interviewing Dr. Vishwas Sickle, medical doctor from Navison Health, talking about sickle cell disease and the diagnosis, treatment, etc. And I really appreciate that information, because I've always wondered about that, and that's some information I didn't know. I thought it was limited exclusively to African Americans, but you just informed and educated me on that. But let's talk for a minute about childhood cancer. How prevalent is it? How to detect it, treatment, and things of that nature. We're about out of time, but just kind of give an overview of childhood cancer.
About 15,000 kids are diagnosed with cancer in the United States every year. About 20%, 1 in 5 of them would not make it, they would die. But 80% of them, 8 out of 10, would get cured, which is great. And this is also Children's Cancer Awareness Month, just as it is the Sickle Cell Disease Awareness Month. And with that in mind, I will be shaving my head, and that's why you see I'm growing my hair. I'll be shaving my head on Friday, I believe 27th of September, the last week of the month, to raise awareness about children's cancer by, Bald for Kids. And I would love to have you all there, and also be ready to shave your heads to increase the awareness of children with cancer.
Oh, wow.
So it is, I want to know that, everybody know that children's cancer is also a curable disease. 8 out of 10 would get cured.
Okay, that's outstanding. Now, tell me how one can find out more information about sickle cell and childhood cancer, because I know there may be members of the audience who's real interested in learning more, or maybe just being more knowledgeable about both of those diseases.
Sure, they can definitely call us at 478-633-2694. We also have a website, and we also have a Facebook presence. However, those are just the website. The new website for the Children's Hospital is about to roll out, so it may take some time, many months before it can be there. It is navisonhealth.org, but you can always call 478-633-2694, and we'll be happy to talk with you about the same.
This is A Call to Action. A Call to Action. I'm your host, Alex Habersham. Have a great day. Thank you, Doc.
Thank you very, very much. It was very nice talking with you.
Thank you. Every now and then we find some real smart people who not only can finish medical school, but they are versatile enough to be intimately involved in other projects and in the community. And sometimes they're even musicians, so we're very fortunate to have with us today, the Dr. Edward Clark, who deals not only with pediatrics, but other things that relates to medicine and as it relates to the community, and we're happy to have him here today. But since it's summertime and the living is easy, we want to make sure that the living continues to be easy by advising the community of certain precautions that one should take in making sure, that you're safe during the summer, particularly our kids and adolescents. This is a call to action.
A call to action.
I'm your host, Alex Habersham. And as I said, we have with us Dr. Everett Clark, who has been around a minute. He just looks young. He probably been
working hard at it.
But we're so happy to have him. He's well, just tell us a little bit about yourself.
Well, Alex, it's good to see you again. I grew up in Macon, Georgia. Went to high school here. Went off to University of Georgia and MUSC over in Charleston. Trained in Greenville, and then came back here when we were starting up the pediatric residency. So I've been involved with that for, going on 22, 23 years now.
Outstanding. So tell us a little bit about the pediatric medicine. What is that all about in the pediatric emergency room? And why is there a need for pediatrics?
What's going on in pediatrics in Macon, Georgia? Well, we're moving forward. We're building a new children's hospital. We've got a pediatric emergency room started, with pediatricians in there. But, the pediatric residency, after you finish med school, you have to do your residency. And those young doctors who choose to want to specialize in kids and young adults, they go into and do a pediatric residency. And we have that residency program here at Navicent Health. It's a 3-year program, so they do extra training for 3 more years.
Wow.
Before they're a full-fledged pediatrician.
So even after you become a MD, you still
got to do some more training.
Do some more, man.
That's right.
Wow.
Pretty much after medical school, you still got to do some more training.
Right. Well, why is there, just for the sake of individuals who may not understand, why is there a need for pediatric medicines as it differentiates from just regular medicine? Sure. I mean, what's the difference in treating
adults?
A 5-year-old and a 50-year-old.
Well, there's so much medicine out there that everything gets more and more specialized. But there's some people that are comfortable working with kids, and some that are not. But it's the kids have their own kind of diseases. Pneumonia in an older child is not going to be the same as in a younger child.
Yes, sir.
And then when you get into treating, you got to treat according to what weight they are. Whereas adults, everybody, for the most part, gets put on you come in with a pneumonia, you're going to, get the usual doses that everybody else does. So you got to be aware of the proper treatment for kids as well. Right. And they have their own problems, sort of different from adults.
And the old folk have their own too.
That's true.
They got geriatric medicine too, don't they?
That's right.
For treating older people.
Pediatrics is the closest thing, I think, to veterinarian medicine. Some of the kids can't talk. Can't talk to you, so you
I understand.
Got to figure out what's going on.
Well, it's summertime, and kids out of school, and everybody wants to have a lot of fun, and the swimming pools are open. And but too often we hang our head during the summer because of some kind of tragic accident, either a drowning or a heat stroke or some kind of problem with fireworks or what have you.
Right.
So let's talk a little bit about, first of all, let's talk about heat.
Well, like you said, it's warming up quickly outside. Safety first with anything, and an ounce of prevention is worth a pound of cure. We've heard that all our life. And with heat, you've got heat exhaustion, which is bad, and heat stroke, which is really bad. But heat exhaustion is where, you're not getting enough fluids in, and that's the main thing about prevention. With young kids, they're out there in the sun. One, you got to make sure they're covered up well. They're not exposed skin-wise. You don't want them to get sunburnt. You want to protect them that way. But also, they're running around. They're sweating just like the rest of us. And even more, you see those kids who are running around and adults are just sitting there, watching them. But they're expending all this energy and losing, sweating. So that you need to replace those fluids. Every 15, 30 minutes, they need to make sure that they're drinking something to keep the tank full of water, so to speak. because when they get low, they're not, urinating as much. They're getting dry. Soon they're going to be getting exhausted from heat exhaustion. So you got to, whether it's water or Gatorade, all of these, kind of sports drinks that have good electrolytes in them, those are sort of the best thing. To do. Back in our day, we would just, pull up beside the house on our bicycle and turn the water hose on and drink, and that's still good. That's better than not doing anything.
Right.
But go inside, make sure everybody's coming inside to cool off on a regular basis, and make sure they're drinking plenty of fluids during these hot summer days to prevent this heat exhaustion and or possibly heat stroke.
Okay, so heat exhaustion is a result of dehydration?
You're getting close to dehydration. This is a result of not having enough fluids on board. You're headed toward dehydration. And then heat stroke is where you're basically, you're probably will pass out. Very well could have a stroke because you don't have enough fluids on board, and you've sort of gone past that heat exhaustion point and gone and had heat stroke.
Yeah, and the interesting thing about that, I guess...
Heat stroke, you need to be calling 911. Quick.
Okay. But the interesting thing about that, I guess there wouldn't be a need for all of these things if, in fact, one would be educated to the extent that to know how to prevent them.
Right.
So just as a matter of repetition, your suggestion is to drink?
Certainly stay in the shade as much as possible. Have fans going, whether you're, trying to fan yourself with something, but basically you want to stay hydrated. So, drink plenty of fluids, continuously. Don't just, drink a glass of water before you go out and play and stay out there all day.
Yeah. And then, so if in fact we've got young people, then it's the parents' responsibility.
Right. They need to remind and make them get in there. If your child is playing sports, you want to make sure those coaches are having frequent breaks for them to replenish their fluids as well.
Okay. And even when they just going out to play,
right.
In the yard or what have you, then I guess it would behoove parents to be
kind of remind them.
Yeah, familiar with.
Right.
That heat
make sure
is serious.
Exactly. Make sure they have a water bottle with them.
Right. Well, that's very, very important. And the other thing about it, although I don't know whether pediatrics can prevent it or not, but too often we have drownings. I guess. Talk about summer safety. I guess that we need to be very, very concerned about water and letting people know, let the kids know that you don't need to go to a swimming hole.
Right. Exactly. You need to be want to be well supervised.
Right.
But first of all, if you got young kids, if you have a pool at the house, you want to make sure it's locked up. I've heard too many times where some kid sneaks out the back. They go into the neighbor's yard, get in their pool, or get in their own pool, or a kid can drown in the bathtub.
Yep.
If your phone rings, you walk out of the room and they slip down, hit their head, go under the water. It's just that. Kids in water, they got to be supervised. The older kids, it's usually doing crazy stunts. They hit their head, and then where's Johnny? And he's on the bottom of the pool.
Right.
So safety first, supervision, have a buddy system, so someone's there watching you, and try not to do crazy stunts that are going to lead to accidents that could lead to drownings. Diving into if you go into a lake or something, these that you've heard where people dive into shallow water, hurt their neck, paralyzed, drowned, etc.
Right. Well, as it relates to drowning and as it relates to the heat stroke, what are there any everyday, like when I was coming up back in the dark ages, and don't you laugh either, they used to say that, there are some things, that you can do if a person's drowned. If you find them in the bottom of the pool, then, can you give them what you call?
Well, you want to start resuscitation.
Right. Yeah. That's
CPR.
Yeah, that's what I'm trying to say,
yeah.
Doc. You the doctor.
Yeah. You certainly want to try it. The quicker you can get them to, to call for breathe on the scene, the better outcome that they're going to have. So certainly, if you find somebody, you want to try and do chest compressions, roll them on the side, sort of clear the airway,
right?
And try and you want to try and get them breathing as soon as possible.
And so does that, when I was coming up, they used to say that compressions was one of the best approaches to it. Is that still true?
Well, that's going to start stimulating and
the lungs.
Getting what if you've got water or something in the airway, when you push down, you're going to try and push that out. So hopefully that'll sort of clear that airway and sort of stimulate them, to start breathing.
Now, does mouth-to-mouth work?
Well, they've sort of gotten away with that. The answer to that is yes. It certainly does. But the most important thing is you doing those chest compressions.
Because that kind of
because that is getting the air in and out.
Right. Well, that's understandable. And I guess also during the summertime and nearing the 4th of July and what have you, people like to play with firecrackers.
Play with fireworks.
My videographer just told me about it, and I didn't hear about it, but this football player playing with firecrackers and exploded in his hand, almost caused him his career. So we need to be concerned about that. So talk about firecracker safety for a minute.
Fireworks, safety first. Again, people doing stupid things lead to bad outcomes, as a lot of your fireworks stuff. But, with younger kids, then, you got to have supervision. Younger kids don't need to be, lighting fireworks or anything. You always want to use whatever the recommendations are of the company that's producing the fireworks. You want to light stuff and step away quickly. Those fireworks that, it's a dud or, it's got a short fuse, let me try and light it again. You're best to just leave it alone and get a new one. That's where usually you get into trouble. People who are going to, doing things where they're going to light a firework and throw it at someone. I mean, that's a setup for disaster right there. You can rupture someone's eardrum. And if that thing goes off too fast, you might be losing some fingers. Yeah. And that's what I think the football player that we were talking about has done. That.
Put somebody's eye out.
Yeah, and cause bad burns as well. And you've seen a lot of these that have a lot of smoke and fire and burning. So you just have to be careful. Need to have a water hose, some water nearby, just in case they start starting a fire or something like that. Right. Like that. Need to be able to put that out. But again, good parental supervision. The parent needs to use good judgment as well, and young kids need to stay away and be far away when the adult is lighting the fireworks. Never point a Roman candle at anybody. Never, bottle rockets. You don't want to put any. Thing in glass or anything that could shatter to explode. I mean, we see all these different type of burns and accidents that happen.
Well, that's extremely important, and I really appreciate you coming on to talk about safety, heat safety and firework safety. And the second part of our show, we're going to talk about, with another physician, we're going to talk about drugs and opioids.
There you go.
The kind of effect that it has on people. This is a call to action.
A call to action.
I'm your host, Alex Habersham, having interviewed Dr. Edward Clark, who's a pediatric physician and has been doing it for over 20 years. Not only that, he didn't talk about it much, but he's also what position you hold with JAM?
I'm the past president for 10 years. I was the president for 10 years. Right now, I'm the coordinator for the Jazz and Arts on Riverdale. Yeah. And that's coming up, be October 21st, where we have our Jazz and Arts Festival on Riverdale Drive.
So the moral of that story is that you can be a doctor
by day, musician by night,
and still be cool. This is a call to action.
Call to
I'm
action.
your host, Alex Habersham. Have a great day.
Thank you now.
Thank you, sir.